people have found out that by enhancing or suppressing these particular hormones, we can get the action of insulin and glucagon as we want it in the body, which means that the insulin level will be increased and the glucagon level can be decreased. So once this was found out, then several compounds came, medicines came, which are called as GLP-1 receptor agonists. They've been around now for about 10-15 years in India also. But the big change came a few years ago when a new type of GLP-1 called as semaglutide was found out. And this turned out to be a game changer because the weight reduction that you get with semaglutide was unparalleled before. That means just taking a weekly injection, you can get 8-10 kilos or even more than that. And also it is basically a diabetic medicine. Therefore, the HbA1c or the sugar improvement, the 3 months control test, the HbA1c, that also dramatically reduced. Apart from that, they also found that the liver fat goes away, abdominal obesity goes away, your craving to eat goes away, which means sometimes we are just not able to stop eating all snacks and so on. That goes away. Recently, some studies have shown that when smokers take this, even the smoking habit goes away, alcohol habit goes away. So many benefits. Now this new one, the semaglutide, in an oral form, tablet form is available in India for many years now, but the injectable came only few weeks ago. What is of great interest is that as of yesterday, the patent for this, for the original molecule, has expired. And as we speak, on March 21st, we have about 50 Indian companies which are producing semaglutide. I don't think anywhere in the world so many pharma companies producing one product. Now, the good thing about it is that because it has become generic now, the prices have crashed. And it used to be a costly drug. So in the US, for example, the costs were 10 times more than in India to start with. Now in India, the cost which has come has also been crashed by 50%, 60%, even 80%. So it has become almost like an ordinary medicine, and the common man will now be able to afford this. That is the big change, and that is why this drug, the semaglutide, is making so much of news.
So we see quite a lot of advertisement regarding this drug, and does the advisory for this?
It is true that because so many companies are coming and the original manufacturers were also there, and this is not the only drug, there's another one, this is just GLP. There's another one, GLP and GIP, which is called tirzepatide, which is supposed to be even better than this in terms of weight reduction and so on. That has also been marketed. So these companies have been advertising very widely, even in the social media, in railway stations, in newspapers, in airports. Everywhere you go, you'll find big hoardings about obesity. So that is one aspect of it, the advertising part of it, which the DCGI has actually condemned and said, don't advertise like this very widely, don't put your logo, don't mention the brand name and so on. That is on one side. The other side is that everybody started prescribing it, as if taking B complex or something. Everybody started prescribing it, gym people started prescribing it, dietitians started prescribing it, online pharmacies started doing it, weight reduction programs which are run by non-doctors, they have started prescribing it. Now this is a very dangerous trend, and the DCGI has pointed out that when the approval for these drugs were given, it was very strictly mentioned it should be given only under the care of a general physician, an MD, or an endocrinologist or a diabetologist. That's been very clearly stated. So even for other doctors to write it, a surgeon or somebody else, maybe they can, but at least they have to be a doctor. Whereas we have seen that people just go to the pharmacy and they give me that weight reduction thing, and pharmacists are giving it. Online, when they order, they don't even ask what the medical condition is. While these drugs are very good, they can also have serious side effects. In fact, there are lawsuits already going on in the US. Blindness can occur occasionally, thyroid cancer, pancreatitis, stomach paralysis, all these have been reported with the drug. Doesn't mean that everybody should be scared of these complications, but at least a doctor who knows about all this should be the one who should be handling it, not some gym instructor. If you see that way, then even a Gurkha can start giving it. He can say, okay, you're overweight here, take this and go. So where do we draw the line? And if suppose somebody develops a complication, who's responsible? Is the government responsible? Is the person who gave it responsible? Is the patient responsible? Is the pharma company responsible? There must be some kind of a control when these powerful agents are coming. Because of the competition between different companies, we should not just open the floodgates and say anybody start using it by hook or by crook, we will sell these medicines. That's a very dangerous thing. Because suddenly if you find some side effects coming, that can be a lot of lawsuits will come in India also, and people can also die due to the side effects of these. So it must be very tightly controlled. So while the drug is very, very useful, the DCGI rules must be definitely followed, health ministry rules, and only under strict medical These are not cosmetic drugs, by the way. They are given to improve your health, to control. They're basically diabetic medicine. So to control your diabetes, to control obesity, when indicated, if there is a health problem, not to look a little better, you take this. For that you can do, gymming, and you can cut down your diet and you start running. That nobody is telling not to do. But to use medication, that too powerful medications, it should not be done without strict doctor's advice.
Social media happens to...
In social media also, I also talk about this drug on social media because people keep asking, what is this drug? Can I use it? Is it safe? How long I should use it? Suppose I stop the drug, what will happen? People have these questions. So apart from the patients who come to me, for general public to know, we also keep putting out these kind of things. But you should not just put on the social media before-after pictures. This is me before and this is me after. What they don't tell you is that half the people stop taking the medicine after about 6 months, and then their weight regain. The weight regain can be even more than what your original weight was. Let me give you an example. Suppose somebody is 80 kilos. Now he has come down to 60 kilos. After coming to 60 kilos, what happens is, I've lost a lot of weight, but last 3 months I'm not losing any weight. So I'll stop this medicine. Remember, the medicine will work only as long as you take it. So when he stops this medicine, from 60 it may become 85. Originally it was only 80. Now it will become 85. Now you may ask, suppose I again restart. It may not work. The body is getting confused. You have given the body certain GLP, you have given some instructions to it. It's working on the brain, it's working on the stomach. Now suddenly you withdraw it. Now the body is confused. Now second time again you are challenging the body by giving this. It may not work like before. We don't know what the side effects will be if you do that. So I always tell my patients, think about it in the long run. If you are prepared to take it for 1 or 2 years at the minimum, then only start the drug. This is not something like magic. You take it for 3 months, stop it, and rest of your life your weight is controlled and sugar is controlled. It's not like that. And that is what I think social media should be used to propagate the correct message. Social media has both sides. You can communicate very correct messages to people and, correct, I didn't know about this. So that also is good. At the same time, if you just misuse it and give all false promises and so on, then you're actually doing harm.
So, treatment or medication for diabetes, one differs from it, and how it is helpful?
You are very right that most of the medications, not only for diabetes, for blood pressure, for cholesterol, for heart, once you start these medications, they are meant to be taken for a long time because the condition doesn't go away. It's not like you have a urinary infection. 2 weeks you take treatment, then you can stop. There's no more urinary infection. Okay? Eye infection. Some other place, TB. 6 months you take it, then you can stop. TB is cured. These are chronic, lifelong, non-communicable diseases. So diabetes, blood pressure, cholesterol, heart disease, these are all different kinds of treatment. So when you start a treatment, it's usually lifelong. We don't say lifelong because so many things can happen. Sometimes the remission can occur, the disease can go away by itself, some stress brought it on, then stress goes away, it can go away. All these things can happen, but in general, they are lifelong. So when these medicines come, they're asking, how long should I take it? I said, how long do you take a statin? How long should you take a BP tablet? Like that, you have to take these medication. So yes, generally they are for long term and they are not for some short term purposes, but things can change. And how they are different, your question is how is it different from the other drug? See, for the other drugs till now, you consider if you take insulin. Insulin is a lifesaver and it's one of the best drugs for diabetes, no doubt about it. Then we had sulfonylureas, we had pioglitazone, we had all these drugs. They're all good drugs, but massive weight gain occurs. As a side effect of these medicines, insulin, sulfonylurea, pioglitazone, weight goes up. some of the other medicines we have been using have been weight neutral. You take metformin or DPP4 inhibitors. They are also diabetic medicine, weight neutral. Neither it will go up nor it will come down. Then we got the SGLT2 groups, which was making big waves like this 2 years ago. Some weight loss, 2 kilos, 3 kilos. But these GLP-1s reduce your weight by 8 kilos, 10 kilos, 15 kilos, which so far no medicine has done. I've been in this field for 40, 50 years. I've been seeing the anti-obesity drugs come. 2 kilos, it will come down. 3 kilos, it will come down. Not more than that. And most of them were withdrawn due to side effects. Within the first year itself, side effects. These drugs have been there now for 8-9 years. And while the side effects are there, not enough to produce a warning or to ban the drug or something. That means the side effects are very, very small. Compared to the effect, the side effect is not that much. That is how these drugs differ from the other drugs which are there.